Hello and welcome. Today we are Group 5, Maxine Francis, Tyler Masmongal, Jada Dyer, Shaniqua Mitchell, Katian Ayers, and Annette Batlish James. And today we will be presenting on Dorothy OREM'S Nursing Theory Deficit. Dorothy OREM'S theory of self-care is a groundbreaking concept that revolutionizes our understanding of individual anatomy and responsibility in healthcare as nurses. Developed by Dorothy OREM'S, a renowned nursing theorist, this theory emphasizes the importance of self-care and self-management in maintaining optimal health and well-being. This theory posits that individuals have the innate ability to assess their own needs, make informed decisions, and take appropriate actions to meet those needs for themselves and others. By empowering individuals to actively participate in their own care, OREM'S theory therefore promotes a sense of self-efficiency and fosters a holistic approach to healthcare. Throughout this presentation, our aim is to focus on the wide usage of this theory and its wide usages to guide nursing practitioners and improve patient outcomes.
Overview of OREM'S theory of self-care nursing. On July 15, 1914, Dorothy OREM was born in Baltimore, Maryland. She graduated from the Providence Hospital School of Nursing in Washington, D.C. in the early 1930s. She continued with her studies at the Catholic University of America in Washington, D.C., where she earned her Bachelor of Science in Nursing in 1939 and her Master of Science in Nursing in 1945. Dr. OREM had a remarkable nursing career. Dr. OREM's model of nursing was then created between 1939 and 2001. She received multiple honorary doctorates from Incarnate Word College in 1980 and Georgetown University in 1976. Both awarded her honorary doctorates of science. In 1988, Illinois Wesleyan University awarded her an honorary doctorate of humane letters, and in 1998, the University of Missouri in Columbia awarded her doctorate honoris causa. Throughout her career, she also received numerous honors, including the Linda Richards Award from the National League for Nursing in 1991, the Catholic University of America Alumni Achievement Award for Nursing Theory in 1980, and the designation as an honorary fellow of the American Academy of Nursing in 1992. OREM developed the self-care theory. This theory focuses on the role that a patient plays in their own care and emphasizes the importance of patient empowerment and self-reliance. It asserts that patients have the ability to participate in their own care and that they should be encouraged to do so. After living a full educated life, Dorothy OREM passed away on the 22nd of June 2007.
Description. The self-care deficit nursing theory was created by American nurse theorist Dorothy OREM. According to this notion, a nurse's assistance in assisting patients in engaging self-care activities to preserve their best health and well-being is crucial. The foundation of OREM's philosophy is the idea that people are capable of taking care of themselves and that nurses can support patients in meeting their needs for self-care when they are unable to do so. The self-care deficit nursing theory has applied extensively to direct the treatment of patients with a range of medical problems in both nursing practice and education. Concepts. The philosophy of self-care deficit nursing is predicated on the multiple fundamental ideas. These encompass the notions of self-nurturing, self-management, and self-deficit. The actions people take to preserve their health and well-being, such as eating, taking a shower, and taking their medications, are referred to as self-care. Self-care deficiency is the incapacity to take care of oneself, whereas self-care agency is the capacity to engage in self-care activities. Metaparadigms. OREM'S theory is subdivided into four main categories: person, environment, health, and nursing. In addition to being viewed as a whole person capable of caring for themselves, the individual may also need nursing assistance in the event that they become incapacitated. The physical, social, and cultural aspects of an individual's surroundings all have an impact on their ability to practice self-care. People can achieve health as a dynamic state through self-care, and the nursing profession provides the support and guidance needed for individuals to meet their needs for self-care. Assumptions. There are multiple underlying presumptions to self-care deficit nursing paradigm. OREM makes the assumption that people want to preserve their well-being and are capable of taking care of themselves. She also makes the assumptions that when people are unable to take care of themselves, they could need help from a nurse. Furthermore, OREM believes that nursing interventions ought to be focusing on assisting people in maintaining their health and well-being and achieving self-care. Relation to Dorothy OREM. The self-care deficit nursing hypothesis developed by Dorothy OREM has had a major influence on the nursing profession. Her theory has influenced nursing education and practice, and it has given nurses a greater understanding of the part they play in assisting people in meeting their requirements for self-care. The development of additional nursing theories and the manner that nurses approach patient care have both benefited from OREM'S work. All things considered, OREM'S self-care deficit nursing theory has had a significant impact on nursing and raised the standard of patient care.
Critique of the theory. The nursing theory of self-care, which was written by Dorothy OREM, demonstrates an excellent way of thinking. This theory states that once a patient can move certain parts of their bodies and are in the right state of mind, the nurses can allow them to administer personal body hygiene procedures for themselves. This procedure can also help people who aren't admitted to a health facility. It practices and teaches people how to properly take care of their health and well-being while in the comfort of their homes. By practicing this theory, persons would feel a sense of independence in supporting themselves and can learn more about self-care, especially now that they have more resources due to the internet to help them do further research if needed. This theory is particularly used in rehabilitation and primary care or other settings in which patients are encouraged to be independent. This way, when taking care of a patient in a health facility, it would be less strenuous on the nurses. This theory helps the patients and the nurses work efficiently.
By understanding and applying OREM'S theory, nurses can significantly better prepare themselves to care for the patients in a holistic manner through several various approaches. OREM'S theory, with no exception, emphasizes the importance of patient-centered care. It recognizes that individuals, to a certain degree, should be self-reliant and responsible for their own care as well as the care of others in their family who require assistance. According to Vasqui, 1992, as nurses, we can apply this theory by directly involving patients in their care decisions, promoting their independence and supporting their self-care capabilities. By doing so, both nurses and other physicians can ensure higher levels of patient satisfaction and improved health outcomes. Personalized care and planning. OREM'S theory highlights the need for individualized care plans that addresses the unique self-care requirements of each patient. As nurses, authors Ali Good and Tommy, 2006, stated to readers of their article that it is impressive that we recognize this since each patient is unique, presenting to us with different conditions. Therefore, thorough assessment of the self-care deficits of each patient and the development of care plans that are tailored to their specific needs are recommended. This approach ensures that each patient receives the appropriate support and assistance required to meet their self-care needs effectively. Enhancement of patient education. OREM'S theory emphasizes the promotion of patient independence and self-care abilities. As nurses, it is our responsibility to empower our patients by verbally providing education, guidance, and support to help them develop and maintain their self-care skills. By doing so, Pim 2023 informed readers of her article that nurses are able to build trustworthy and compassionate relations with their patients, which enable patients to actively partake in their own care, identify deficits in care, and now lead to improved outcomes and a sense of empowerment for the patient.
Holistic approaches. OREM theory, in addition, recognizes the holistic nature of nursing care and the importance of addressing each patient's physical, psychological, and social needs. As mentioned before, each patient's care is quite unique, requiring us as nurses to apply this theory by considering the various dimensions of patients' well-being and developing care plans that encompass each and every aspect of their health. Now, in accordance to studies conducted by Reggie's College 2021, this holistic approach now fosters a sense of well-being and promotes an enhancement of comprehensive and yet patient-centered care. Furthermore, evidence-based practice. OREM'S theory provides a foundational framework for evidence-based practice in nursing based on this particular theory. By integrating this theory with current empirical research, critical thinking skills, needs assessment, evaluation, and best practices, author Kadiman et al. 2020 explained to their readers that nurses can now ensure that their interventions are effectively prepared based on the most up-to-date knowledge and evidence. This prepares nurses to promote care that is of effective, high quality, and yet maintaining safety for all patients. Lastly, versatility in practical settings. OREM'S theory is quite versatile and applicable in many various healthcare settings, including acute care units, ambulatory clinics, community settings, intensive care units, high dependency units, senior citizens' homes, hospice, and rehabilitation centers. Author Donna 2022 stated to readers of her journal that as nurses, we must be able to apply the principle of OREM'S theory, regardless of the setting in which we work. This adaptability makes the theory valuable for nurses in preparation for diversification within healthcare environments. By utilizing this theory in these various settings, nurses can now ensure that patients receive the necessary support and education to manage their health outside of the hospital setting, leading to reduced hospital readmissions and yet improved patient outcomes.
Dorothy OREM has had a significant impact on nursing science, education, and the profession in several ways. Foundation of nursing practice. OREM'S theory provides a framework for nursing practice that emphasizes the role of self-care. The framework helps nurses assess patient needs and decide how to provide care, which can be utilized to everyone's situation. Nursing education. Nursing students learn to apply the concepts of self-care, self-care deficit, and nursing systems in their clinical practice, which prepares them for real-world nursing roles. Patient empowerment. By educating patients about their health conditions and the importance of self-care, nurses can promote healthier lifestyles and self-management among patients, which can lead to better health outcomes. Research in nursing. Researchers have used her theory as a base for studying various aspects of patient care and self-care, which has contributed to the development of evidence-based nursing practices. Professional development. This perspective enhances their role in the healthcare system, increase job satisfaction, and boost the sense of professional competitive amongst nurses, specialization, and advanced practice. The concepts of self-care deficits and nursing system have encouraged the development of specialized fields within nursing, such as diabetes education, where nurses not only provide care but also educate patients on managing their conditions through self-care.
Healthcare policy and administration. OREM'S theory can be applied to the development of healthcare policy and administration, particularly in creating patient care models that stress the importance of self-care and preventative health measures. Interdisciplinary collaboration. The concept of healthcare deficits and nursing system encourage collaboration with other healthcare professionals to ensure a comprehensive to patient care, which is essential for addressing the complex health needs of patients. Global health. OREM'S theories has been applied internationally and is adaptable to various cultural contexts, making it valuable for guiding nurses' practice in diverse healthcare settings around the world. To conclude, DOROTHEA OREM'S nursing theories has deeply influenced the nursing profession, sharpening both the practical and educational aspect of nursing and contributing to the evolution of nursing as a science.
In conclusion, OREM'S nursing theory of self-care serves as a powerful reminder to us as nurses that individuals are not just recipients of care, but active agents in their own health journey. By emphasizing the importance of self-care and empowering individuals to take responsibility for their own well-being, this theory has significantly influenced the field of nursing and healthcare on a whole. Moreover, this theory challenges traditional notions of patient dependence and promotes a holistic approach that recognizes the intrinsic capabilities of individuals to care for themselves and others. Lastly, OREM'S nursing theory highlights the transformative potential of self-care in promoting optimal health and well-being for individuals and communities. As we come to an end of this presentation, we thank you so much for your time. This was Group 5's presentations on nursing self-care deficit. This theory was based on Dorothea E. Orem. Thank you so very much for your time. The end.